And finally, our last speaker in this section of digital delivery of healthcare, we have, and I'll give Audrey a minute to just come up to the podium here. We have Audrey, and Audrey is a senior cardiology physiotherapist in Sligo University Hospital, and she's worked there as a physiotherapist for over 20 years. And her specialist interest is cardiology and rehabilitation. And she just recently completed her master's in health promotion at IT Sligo. And her presentation at the conference is based on the research she undertook. And just as a little matter of interest, Audrey is a champion of promoting females in sport, and is currently doing a master's in leadership in sport as well, and going to do some more work in there. But for now, in terms of this conference, I'll hand over to Audrey for her presentation, which is a pilot study comparing patients' outcomes in cardiac rehabilitation phase 3 in Sligo University Hospital pre and post COVID-19.
Thank you. So this was a presentation that I did as part of my thesis. The title is a pilot study comparing patients' outcomes in cardiac rehab phase 3 in Sligo University Hospital pre and post COVID-19. So just for those of you who may not exactly know, cardiac rehab is a multidisciplinary team program that mainly consists of 5 different components. We are very lucky in Sligo University Hospital. We have specialists in all those areas. We have exercise, we have the dietitians that adopt a healthy diet, we have a psychologist advising around stress, we have our pharmacist advising around medication, the importance of medication, and all disciplines advise around stopping smoking, and we also have the help of our nursing staff in the hospital as well. So the different phases of cardiac rehab. Phase 1 commences in the hospital. This is where the patients are given their diagnosis and a management program is commenced. From a physio point of view, I give them advice on an exercise plan to start in the hospital, and they continue that at home. Phase 2 varies in length. With us, we try to get the patients in as our waiting list allows. Some hospitals, it's a little bit longer. We would aim, if at all possible, to have them in within 8 weeks of their event. This then when phase 3 begins, and again, it varies from hospital to hospital, but it tends to be between 6 and 12 weeks in duration. And again, it's down to waiting lists, it's down to hospital resources. And then phase 4 is a long-term chronic disease management, which takes place in the community. So as we all know, COVID-19 changed the way the health services in Ireland could safely carry out both in and outpatient activity. In order to adhere to COVID-19 Health Protection Surveillance Centre guidelines, it was necessary to change the exercise component of cardiac rehab. There was no published data to guide or inform us in cardiac rehab if this new modified programme would yield the best outcomes for our patients. So we were one of the first hospitals in Ireland to resume outpatient cardiac rehab programme. We're in a very opportune position to research the new programme, inform other hospitals if what we were doing was positive in terms of outcomes for our patients. So pre-COVID-19, our patients would come in usually in groups of 8. We do warm up for 10 minutes, and then our aerobic part consisted mainly of bikes, steppers, cross trainers, rowers, and then we did a cool down. We did have very little strength and conditioning, part of it mainly due to lack of equipment in the hospital. So this is just a visual of how cardiac rehab was pre-COVID. Post-COVID, then the patients had to wear a mask. They had to keep 2 meters apart. Due to the space in the hospital, we could only have 4 patients in the class, no sharing of equipment, and we did a lot more resisted upper limb strength and lower limb strength and work, as well as aerobic work with the patients. And that's just a little visual. Obviously, those people aren't 2 meters apart, but ours very much were. So our aims and objectives: evidence-based practice is the main objective of modern medicine. Sláinte Care tells us that we should be providing the right care in the right time in the right place. So we wanted to ensure that the post-COVID-19 patients were achieving as good exercise outcomes as those pre. and we wanted to continue to safely and effectively provide the right cardiac rehab in the right time, in the right place. This study was a retrospective quantitative cohort study of patients in phase 3 cardiac rehab. Group 1 completed their cardiac rehab in 2019. They were classified as Group 1, and Group 2 completed their cardiac rehab in 2020. Patients' data was put together from various different sources, such as the integrated patient management system in the hospital, their medical notes, and their cardiac rehab documentation. All our patients have an exercise stress test performed pre-cardiac rehab and post-cardiac rehab. This gives us an idea of their baseline fitness levels so that we can then give them their exercise programs based on that. Specifically, we look at the time they did on the stress test, their METs, their heart rate, and their blood pressure. And we aim to repeat this within 2 weeks of completion of the cardiac rehab program. Our metabolic equivalence is the amount of energy it costs to complete a task determined by the amount of oxygen it requires. So analysis, coded data and diagnosis, medication and patient demographics was entered into Excel. Then we looked at means and standard deviations, then coded data on their heart rate, blood pressure, time and METs. We put that into SPSS and did some analysis on it. Initial analysis was carried on Group 1 independently and then Group 2 independently. This was carried out using paired t-tests, using to compare the differences between 2 variables, their pre-rehab outcomes with their post-rehab outcomes. Further analysis was then carried out using independent sample t-tests to compare the means of heart rate, blood pressure, time and METs between the 2 groups before rehab and after rehab. So the strengths of this study, thankfully no patients who were offered cardiac rehab during COVID-19 declined attendance due to fear of contracting COVID. No patients and staff members were actually vaccinated at time of the study. No patients, our staff contracted COVID during cardiac rehab, and this is new research during COVID-19. Some of the limitations that affected our COVID patients were there was government restrictions in place into the exercise outcomes or options that the patients could do outside cardiac rehab. We very much encourage our patients to exercise outside the class. So some of them were even limited to a 2K radius of where they could go for a walk. No gyms were opened, no Pilates yoga classes were available to the patients. This did obviously not affect the patients pre-COVID-19 when their assessments were carried out, and this may favourably affected their outcomes on their post-rehab stress test. Due to time constraints, we didn't capture any qualitative data, and it only captures a small amount of data on a small number of patients in one hospital. So our results overall, just looking at the likes of their ages, they're very comparable, heights and weights very comparable as well. Obviously, in our study, there is more males to females. It's not that they were excluded or that they didn't wish to take part. That was just due to the numbers of patients that we had in the hospital. We do tend to have more males and females, and that's not just local to our hospital either. So the results, the diagnosis of the patients in both groups was very similar. One difference is that one patient had had valve surgery. We had no patients with valve surgery in the other group. Their medications obviously then were very similar because they had the same diagnosis. So our results show that the participants in Group 1 pre-COVID-19 showed statistical significant improvement in time and METs on their stress test, but clinical significant improvements in heart rate and mean arterial pressure. Participants in Group 2 showed statistical significant improvement in time and clinical significant improvement in METs, heart rate and mean arterial pressure. A comparison between outcome between the 2 groups showed no statistical significant difference between the groups, which is a very positive outcome for our patients in post-COVID-19. Those in the new format class did as well as those in the pre-COVID class. And this is despite our class only running for 8 weeks as opposed to the other class got 10 weeks. So despite all the challenges during COVID-19, healthcare workers have shown there's an amazing ability to adapt, to change, to provide the best possible services and care to our patients. This study is just one such example of how cardiac rehab services in the hospital adapted and changed and allowed the patients to continue with a highly recommended and cost-effective part of their treatment. Just some points of note which I find quite interesting in relation to mask wearing. Obviously, the patients in group 2 had to wear masks while they were exercising and during their stress tests. And a recent published study on 12 healthy subjects show that while it is safe for them to wear the mask during exercise, there is a reduction in performance on exercise stress tests with those who wear a mask. And it is possible that a similar effect would have been seen in our post-COVID patients, but we at the time didn't know that this research was available. So we probably could look at the results in terms of that. COVID-19 has also impacted the patients in this study. The patients had 4 hours, 240 minutes less exercise in the pre-COVID group, and these extra hours of exercise could have contributed towards better outcomes for a pre-COVID group. In the long term, it would be really interesting to look at hospital readmission rates, repeated cardiovascular events, and the need for further interventions in the patients outside our hospital who've had kind of major gaps in their access to cardiac rehab over the coming years. So in conclusion, we now have evidence to prove that patients attending cardiac rehab in our hospital performed as well on exercise stress tests as those pre-COVID-19. Cardiac rehab patients in Sligo University are indeed receiving the right care in the right time, in the right place, and cardiac rehab for the foreseeable future can continue in its new COVID compliant format. Thank you.
Thank you very much. Thank you very much, Audrey. And it's wonderful to see a piece of research that actually proves that actually those heroes have done an excellent job in terms of pivoting to ensure that the quality of healthcare is met and finding innovative ways to do it. So I'm just going to, I did see something come up on the chat box there from one of your colleagues who's on the health promotion course with you to say well done from herself and your class. So I'm just going to open the floor to any questions that there might be at this point. Yeah.
I was just curious, internationally, so was actually a dip in presentations during the start of COVID when people were seeing heart disease and MI, and did that influence the number of participants on your group? Because they seem to be evenly matched. So did you have that here in Sligo? Did you notice a reduction in referrals to cardiac?
No,
I'll just say, did you notice a reduction in referrals to cardiac rehab during the COVID phase?
No, our referrals would have stayed pretty much as they were. I think locally on the media, we put out very quickly from the hospital the importance of our patients in needed to attend the hospital, that they shouldn't be staying at home if they had any symptoms of cardio, chest pain or that, and that was put out locally, I think, and nationally, but definitely we may have had maybe 2 patients who were late presenters, but not a great amount, thankfully. And maybe just to link in as well, because everyone else is looking at virtual telehealth, we were fortunate that we were able to offer our patients to attend the CRE virtual cardiac rehab program in conjunction with our one. But interestingly enough, only 12 of our patients out of 100 wanted to attend it. They all said they'd prefer to wait on our waiting list, even though it would be a while, and attend. In saying that, the outcomes of our patients who attended the virtual cardiac rehab were fantastic and were very positive. So I think we do need to look at a more hybrid approach to cardiac rehab going forward, because I don't think everybody can necessarily attend the hospital. Likewise, people like to attend the hospital, but I think we could look at a more hybrid approach for cardiac rehab.
Excellent. Well, I think that's the kind of take-home message from this section, is the need for a hybrid approach while advancing with all these wonderful innovations in terms of digital technology. So thank you very much. I'm going to stop now for lunch so that we, our people online can come back and join us at 2:15. And for those in the hall, we'll stop for lunch now. And thank you all.
Thank you.